So tonight we're going to ask you a few questions around care coordination, how it's been working for you, and what kind of other services would be valuable to you, including other value-added services, and also how the managed care organizations are currently communicating with you and how they can better communicate, and any other ideas that you want to give us feedback or input on. I do want to take just a moment for the state staff to raise their hands so you know who's here. If you have any questions at the end, you can grab any of the staff and they can get you connected with the person or people that you need to be connected with. And also the managed care organization staff. We have some folks over here, so if you have any specific questions for the managed care personnel, they're here. And now I'll turn it back over to Jennifer. Thank you.
So I just want to talk a little bit about kind of the format of a meeting, and then I will hand it over back to KDHE. So with the topics that Dr. Mosier just spoke about, we are going to go through a round of information from KDHE, and then for that topic, we will gather comments. So we'll be moving table to table to get feedback and comment from you, and we'll gather it, and then we will actually move on to the next topic and do the same thing. We have 3 rounds, and at the end there will be time for open comment. So if you don't get your question or comment in for that specific round at that time, there will be time at the end to give it. So at this time I want to talk a little bit about logistics so everybody's aware. If you have your cell phone on, if you could turn it to vibrator silent, that's great. We have refreshments in the back. We want to make sure that everyone is aware of the restrooms out the door to the left. I also want to point out that Carrie Bacon from the Ombudsman Office is in the back of the room. Thank you. To answer questions if you have that for specifics for her as well. And at this point I want to hand it over to Mike Randall. He's the Director of the Division of Health Care, Finance, and the State Medicaid Director.
Good evening, everyone. Thank you again for being here. I'm going to go through a presentation briefly, and then as we're talking about, we'll get into the questions and be able to kind of get that feedback from you. Now, this is what we're doing. We're getting feedback from the providers. We had the meeting this afternoon, so this is the second meeting of 12 scheduled across the state. It's the first city in which we're having the meeting. We have 6 different cities in which we're providing these sessions throughout the state of Kansas. But right now, we want to get that feedback from you tonight. Once we have the feedback, we've incorporated that into a draft RFP. We'll again have fall meetings in which we go through this process again, which I would presume that we would go through the same cities, some of the same schedule as far as getting feedback of what we've posted as far as a draft RFP. And information on these meetings will be posted on our website as soon as possible. So I would anticipate within the next few days you'll be able to have copies of the presentation and the information will be available on the website. The KanCare multi-year renewal. We will renew the program, so the new date of the program will be effective January 1st of 2019. It will run for at least 9 years. So our initial demonstration period was from January 2013 through the end of this year, December 31st of 2017. And so it will at least be another 5 years beginning in January. We plan to submit that renewal application by the end of 2017, so November timeframe of this year. But we want your input for that renewal application, and so that's why we're here. The multi-year renewal process may be a hard slide for you to see, but I'll kind of read through it for you. So we're conducting these meetings May, June of 2017. We're going to develop the draft, the RFP. We'll be taking the summer of this year to do that. We'll post that application and review public hearings the fall of 2017. So as I mentioned, we'll go through this process again. The application will be submitted to CMS hopefully November of this year. CMS will have the public notice and consultation with the state, so we'll take time throughout 2018 to negotiate with CMS the standard terms and conditions, which will be in place by the end of December of 2018. So we have that effective date of January 1st of 2019. KanCare extension, which is different from the renewal, so this is the extension. So as I said earlier, we have our current level 15 waiver demonstration period, which began in January of 2013. That ends December 31st of this year. We're working with CMS for a 1-year extension of that original demonstration All that does is change the timeline. It does not change any services that are provided. It doesn't change any populations that are served. It simply moves the expiration date from December 31st of 2017 to December 31st of 2018. We will also be having public hearings July 6th and 7th on this extension. I believe those meetings are in Topeka and Kansas City and Wichita. Again, the process for this one-year extension, we're conducting the meetings. We'll have the draft application, which was submitted to CMS in June. It's going to be posted for public hearings. The extension submitted to CMS July, August of this year. And we hope to have approval and special terms and conditions or our new contract, so to speak, with CMS August of this year. Just want to spend a few minutes on KanCare now, kind of what it is. You know, KanCare is the name of our Medicaid and Children's Health Insurance, or CHIP, program in Kansas. It was really created, and Dr. Mosier alluded to this, to improve better care for our members, improve the health, and offer those extra services that we really couldn't do in a fee-for-service model. KanCare serves more than 400,000 people. You can see that more than half of those are children, about 25% are elderly or people with disabilities. 7 different groups receiving the home and community-based services, so we have 7 waivers that are within the 1115 waiver demonstration project as well. I won't read through this entire list, but I just wanted to give you a sense of the beneficiaries that we serve within the KanCare program. So as I said earlier, children make up more than half of our population of 400,000, but you do have pregnant women, individuals with disabilities, and so on. KanCare benefits for Kansas. When we went to KanCare, there were some new services that we were able to provide. So we had weight loss surgery, heart and lung transplants were added to the Medicaid program. But really more importantly, I think, is the value-added services the MCOs were able to provide. And through 2016, the MCOs have provided almost $19 million worth of these value-added services to our members. So KanCare multi-year renewal topics to discuss. Dr. Mosier spoke briefly about those. Continued improvement in care coordination, value-added services. We talked about these are the types of value-added services that are being provided now. What's worked, what's not worked. Do you want to see additional services? Just want to make sure that those MCOs are offering those services that our members really want and can use. And then how managed care organizations are communicating with you. So care coordination, briefly, and I won't read through this entire, but care coordination, really what it does is make sure you get the right services at the right time. It teaches you about your conditions, how you can help yourself. It helps you reach your health goals, and that's what that individual does. To make sure you get other services and supports that you need to stay in your home. So what are those types of services? And so that care coordinator kind of wraps all that around to ensure that you get those services at the right time in the right place. MCO care coordination. You know, when we renew the program, we want to make sure that care coordination is being provided appropriately to those individuals who are supposed to get it. We've been out, Dr. Mosier, myself, and other members of KDHE, KDAS, we've been out across the state in the last year and a half, and we've heard that care coordination may not be what we expect it to be, what we want it to be for our members. You know, are they seeing their care coordinators? Do they know who their care coordinators are? So you want to make sure that everyone knows who their care coordinators are, and that they have that face-to-face contact if that's appropriate for that particular population. So questions to consider for care coordination. So how has care coordination worked for you, and what would you like to improve about care coordination? So what we're going to do is we'll spend about 5 minutes at the table, and we'd like you to discuss these 2 questions, and then Wichita State will come around, and they'll go from table to table, and we'll take your comments, we'll take your questions, and we'll go from there. All right? Take about 5 minutes. Thank you.
How we'd like to do this is we have with us today from WSU Seth and Lindsay. They're going to move table to table with microphones to get your comments and feedback and input. We're going to get all the comments from one table for this topic and then move on to the next table. So they'll kind of be hopping tables in order. So I think we're going to start with Lindsay here at table 4.
We were discussing that having care coordinators assigned that are more specialized. I realized that our goal was to break down some of the silos, but when families are looking for information, They sometimes have a care coordinator that runs across multiple populations, and they may understand nursing homes, but they don't understand intermediate care facilities. They may understand frail and elderly, but they don't understand the issues related to their child with an intellectual or developmental disability. So either additional education for the care coordinators or some specialization for those individuals that present highly specialized needs.
Right, so by population. And that's a great point, and we have discussed that too, as far as how we can improve care coordination. But you're right, with special needs, so thank you for those comments.
Yes, I'm a nursing home administrator, and I'd like to know why it has to be so long to get anybody signed up for Medicaid.
So I would answer your question later, because we want to focus on care coordination, so I want to make sure everyone has the opportunity to address that. We'll have an opportunity later at the general comment session to discuss that. I'd be happy to answer that question for you, so we will do that then. So let's try to focus on care coordination.
I'd just like to put in a plug for targeted case management across all waivers. The need for that is huge.
All right, so we'll go on to the next. So value-added services. We talked about value-added services. These are those additional services that the managed care organizations offer. Pest control, sometimes they have little gift cards that they give out, small denominations. Dental cleanings, that's one of the largest value-added services that's provided to our members. Our adult dental services. Many people use these services, but a lot of people don't use those services. So we want to make sure that we are providing those services or asking those MCOs to provide the services that add the greatest value for our members. And so when we renew KanCare, we're going to ask those MCOs to provide those services. And we renew that. We add, subtract, or change those services on an annual basis. And the MCOs submit to us a list of potential or what they would like to have as value-added services, and we approve that as a state. But again, the bottom line is we want to make sure that we provide those services to you that are the best value-added for the membership. So really, two questions to consider. Which extra services have you used or have you found most useful that you'd like to see continued? What new ones would you like to see? So again, take about 5 minutes or a little bit longer if we need to discuss those with you, and I'm being told that you have this document at your table. So if you're asking yourself, what value-added services are provided now? These are here, right here, this document. I see some of you already have it up, but it has all the value-added services from your 3 MCOs.
So we were just talking about the dental services that you guys provide, and she was just saying that it would be beneficial or helpful for her to help cover for the fillings when they have, or for partial dentures, because that's what she has, and most of the time when she does visit the dentist, she has to pay out of her pocket, and it's a large amount that she feels for her, that's for her, so she would like to see help on that part of the dental services.
Thank you for those comments.
Much like the past table, absolutely enhanced dental services for more prevention and those low-level carry fillings. A larger dental network, although we appreciate, at least in the world of providing supports and services to children with intellectual or developmental disabilities, many of the value adds across dental, it's hard to find dentists, especially those that will do anesthesia, which is somewhat specific to some of our population. I think better communication of the value adds to the members. I'm not sure the members fully understand all of the value adds that are potentially available for them.
Do you have a suggestion on how we could do that?
Well, I think it starts with the care coordinators, and are they communicating across each of the plans what are those value adds for that member? I think looking at their care plan more thoroughly and saying, here are some potential value adds. Yeah, going back to that value add, against their needs. We also, I think there's been some increased questions and needs for pest control across the value adds across all 3 plans, and I think there's some health benefits related to that. And then we certainly do appreciate the Medicaid change for the adult briefs. If someone has a diagnosis that fits the need for getting adult briefs, I think that will help as well. So thank you, Kansas, for including that.
Hi, I'm Sonia with Oral Health Kansas, and I wanted to piggyback on what the other folks were saying. We do get calls from people who end up going to the ER for some of their dental care, and they don't have funding or some way to pay for their services. So that's something that we get a lot of phone calls about.
As far as new extras I'd like to see the state of Kansas pay for developmental and psychological testing from licensed psychologists, just as required by the Social Security Administration.
Most helpful and useful. I get to go to Wamego dentist and for a small out-of-pocket fee, and my transportation is covered to do that. So I'm grateful for that. And transportation to and from appointments is also covered. My doctor has certified me to have transportation to and from my appointments. So that's most useful. Keeps me out of the hospital. My transportation keeps me out of the hospital. And that's all.
Thank you very much. MCO communication. So each year, you choose which MCO you want. You send information about how to go through that process. Your MCO also sends you special messages, brochures, bulletins. But we want to make sure that the MCOs are sending information in a manner in which is best for you. So there's a lot of communication that goes out there. The state sends communication, the MCO sends communication. So with respect to this, we want to make sure that you're getting that communication in the method, the terminology, the language that is best for you. So questions to consider around MCO communication. Do you understand the information that the MCO sends you? Is it easy to get questions answered when you call your MCO? And how can your MCO better communicate with you? So again, let's take 5 minutes or so and let's discuss those questions at your table, and we'll come back and we'll address those.
Also, if you don't feel comfortable talking in front of the group, there are note cards on the table for you to write your comments as well. So we'll do the same process. We'll move table to table and move through comments and questions. And
one thing as we're waiting for questions or comments, at your table there are samples of communication and information that the MCOs do provide. So take a look at that.
We feel like the web portals on each 3 of the managed care organization sites could be more member-friendly, so working on that. There early on and continues to be differences between managed care organizations and their care coordinator communications back with the members and their guardians, and they're vastly different. And I think there needs to be some examination of why that is occurring. Why can you reach some care coordinators at some MCOs, not reach care coordinators at other MCOs, and get sent to call centers out of the state, and your issues are resolved much later, and other managed care organizations are able to resolve those quickly within 24 to 72 hours. Finally, mail. Some guardians get their mail, some individuals who are assigned court-appointed guardians get the mail, and some organizations who provide services to individuals who have court-appointed guardians get the mail. From the state, from the clearinghouse, from the managed care organizations, and I think we need to figure out a way between the organizations that support the members, if they have case managers and their care coordinators, on how to ensure that the addresses are accurate in the state system, so that those members that are assigned court-appointed guardians are getting the information for their loved ones or wards.
Her concern is about being able to understand when they call her because of her language. She did receive a call yesterday, and she was up to right now. She's still wondering what is about, because she didn't understand, and she would like to have an interpreter available for her when she calls or when she receives a call.
So did she request one at that point?
She said she did, and they were going to give her a call back.
Okay. I just want to make sure you're aware that those services are available.
I called my MCO, and they basically said, we can't answer that question, you need to call KanCare. So I called KanCare, and they wouldn't answer the question because I wasn't the durable power of attorney over finances. So therefore, it was difficult for me to tried to confer to my brother, who is the power of attorney over finances, to say, I can't get this information for you. So it was general information that wasn't answered for me. They wanted to draw it into specific to our case, and that wasn't the question I was asking, and I still don't have an answer.
And I understand your frustration, but we have to be very careful in dedicated communication, because and really even technically, for me to communicate to you and even say the person is on Medicaid could be a PHI or health information we shouldn't share. So if you want to be able to call in and ask those questions and get those answers, then go through the documentation and get that release of information so that they can communicate with you.
Well, the other question I have on that is you know, they said that I would have to get permission to get that information. My brother would have to sign the form and provide a durable power of attorney over finance form, which we've sent to the state 3 times, and they wanted another one to prove that he's durable power of attorney over finances. And I'm thinking, okay, how many times do we have to submit it? So it's frustrating, you know, dealing with that, you know, just to try to get something done. And then it took me almost 2 months to get the form for me to fill out from KanCare.
So are you trying to get eligibility for an individual?
We've got eligibility, but I'm trying to ask questions and I'm not getting any answers.
Unless you have that documentation on file, we can't address those questions. So
It is on file.
Let me, for you specifically?
Well, the durable power of attorney over finance.
Let's do this. Let's, after the meeting, I have staff here that can take some information from you and contact you tomorrow or whenever we can, and we'll provide you with information. This is what you need to do to be able to get those questions answered.
My comment was specific, though, that even if I ask general questions not relating specifically to, nobody would answer my questions.
Well, it just really depends too on what you define as general questions and what we may consider information we can't answer. So
Okay.
I'll, after the meeting here, stay here and I'll have staff communicate with you.
Okay.
Right now, we're going to kind of transition to what else do you want us to hear tonight? So we had 3 topics, very specific. So this is the opportunity for you to, we're not going to spend time at the table, but if you have a specific question that you would like addressed, general question, and we'd be happy to address that question. If you have additional comments you want to make, that would be fine as well.
I would just like to say that I'm very thankful for Sunflower. I know I had some problems, but I am very, very thankful for my medication as well. As I said earlier that I'm thankful for the transportation, which I am very grateful. I'm also thankful for my medication. It along with that keeps me in my own apartment with a cat, and I cook for myself, I clean for myself, I do other people's laundry in the building, I help, you know, so I'm in an elderly high-rise, and so I just wanted to say I'm thankful for it. I couldn't be in my own apartment if it wasn't for Sunflower. I couldn't be on my own. Thank you.
Thank you. Bless your heart.
I do have a question, and that is my concern in Johnson County. We have one ombudsman for Johnson County, Leavenworth, and Wyandotte County. That one person cannot cover all the issues that there are for the people living in nursing homes. So get us some more ombudsmen, okay?
Thank you.
Appreciate it.
You're welcome.
Does the Medicaid program here in the state of Kansas have the money to consider offering developmental and psychological testing from licensed psychologists, or would that be something that would have to be requested through the state legislature at this point?
Right now, that's not a covered service in Medicaid, that there was no appropriation for that. But let me take a step back and kind of go through a process that we do as far as Medicaid. You know, we have a medical review team, we have a clinical staff, and there are policies that are proposed with leadership and decisions can be made whether we do or do not cover those services. But there's always a fiscal impact to that, so we have to understand what that fiscal impact is. But if that's something that we would want to move forward with, we would go through that process, determine if that's something we want to have as a Medicaid service, and then we would have to go through that appropriation process, yes.
And how does a person as a individual get to put their 2 cents in for that process to try to see if it can come to fruition as an actual thing?
A couple of different suggestions or avenues you might want to take. I mean, the first I would take is contact your state legislature.
Okay.
And make that recommendation. Say, hey, here's what we would propose, and this is why.
All right. Thank you.
You're welcome.
I just wanted to remind you about the woman's question earlier about enrollment, and then I also wanted to ask, one thing you didn't talk about when you were going through the schedule was the schedule for soliciting new MCOs for KanCare 2.0, and how does that fit into the timelines laid out?
Thanks for the reminder, but I've already talked with the individual. I went over and talked to her right after, so I didn't hear that.
We'd like to hear that. We'd like to hear what you said.
Secondly, as far as the schedule and the MCOs, I'm not quite sure I understand as far as, are you talking about when the response? The RFP will go out November of 2017. That's when the MCOs, or those potential MCOs, or health insurance plans that want to bid, will have that opportunity. We'll allow them an ample opportunity to provide us the bid, probably early spring. Then we will go through an internal process, KDHE and KDADS, through like normal procurement, an evaluation of those bids, and then we'll make the appropriate award. We're hoping to make the award early enough so that if there were transitions, that there's time to do that.
So that will then happen parallel to the process of negotiating the terms and conditions with CMS. I'm just wondering how an MCO bids on something if they don't know what they're bidding on.
Well, they will know what they're bidding on. The special terms and conditions we have with CMS is a contract or agreement we have with CMS, not the MCOs. That's between us. So the request for proposal is very detailed. So every health insurance plan or MCO is going to bid on this business. They'll know exactly what the expectations are for the state of Kansas and the KanCare program.
Then to get back to the first question, could you just give us an update on where we are on the enrollment backlog?
We have no backlog. So I'm happy to say that every application that's really over 45 days has been touched. Are there applications over 45 days that haven't been processed? Yes. And the majority of those are elderly and disabled. A lot of long-term care, but that's a very complex process to go through applications. So a lot of that information, a lot of the applications, we're waiting on information from members to return back to us. And so we're going back and forth. But as far as the backlog and what we've gone through in the last year, the backlog has really been down to what we call normal levels. You're always going to have a number of applications over 45 days.
Yeah, the question's about, the need to, for somebody who's on KanCare or Medicaid services, the need for them to continue with supplemental Medicare insurance like the Blue Cross Blue Shield, Medicaid, covered medications, room and board, supplies and equipment, that kind of stuff.
I would, I don't want to put Russell on the spot. So
I do.
Well, I think what you're asking for the state of Kansas to give you a recommendation of whether to carry a Medicare supplemental policy for a member who's on Medicaid? Is that the question?
The person already has Medicare A and B.
Okay.
They've qualified for Medicaid.
So they're dual eligible.
They're dual eligible, yeah. So, I mean, I don't see the need for them to continue with supplemental insurance if Medicaid is going to pay for the same stuff.
Well, afterwards, we'll just...
Yeah. So that...
Yeah, I truly understand, absolutely.
All right.
Okay, I'm looking around the room one more time.
Oh, it looks like we do have a hand wave at table 10.
One.
Sorry. We've been hearing a lot with KanCare 2.0 that we're looking at value-based purchasing. Will there, potentially, in those contracts, will there be some public information regarding what is meant by value-based purchasing with KanCare 2.0 in the near future?
Yeah, I think as we go through this process, and I think I talked about it this afternoon, the provider stakeholder meeting, that we want to make sure we work with the providers to get their input on what that looks like as far as value-based purchasing, because it's going to mean something to you, it's going to mean something to him differently, and it's something to him differently as well. But we want to make sure that we incent the correct behavior. So we want to make sure we have the correct quality outcomes and what direction we want to move forward, better health for individuals. So as we set those programs up, yeah, we will be bringing in having public input. Probably not, I don't want to say public input, provider input.
Okay, thank you.
Are they not qualified after 65 for this insurance? After 65 years old? She has Medicare. She has Sunflower, and apparently somebody knocked her door a couple days ago, but it has nothing to do with Sunflower, but she just showed me the business card. But they told her that after 65, Sunflower would not cover.
No, that's not an accurate statement, so I'm not quite sure who came and knocked on the door, but that's not. All right, so again, this evening, I want to thank everyone for your time. I know that kind of not in the middle of dinner, but the beginning of dinner, probably, so we appreciate that. It's always difficult for us to determine what kind of time to set these up for the members, but we try to do our best, and 6 to 8 normally works the best for the members. So we do appreciate your time and willingness to come here. If you go home tonight, you get up tomorrow morning or the next day or two, and you have other comments or questions that you have, recommendations, please email kdg.cancarerenewal@ks.gov. We'll have the information, or if you like snail mail, you can mail it to KanCare Renewal, care of Becky Ross, and have the address there. This information will be on the website the next day or two, so you can have that to review. And we'll be taking those comments and suggestions really all the way up until sometime in October. So we'll continue this process. All right, again, thank you everyone. Appreciate your time and have a great evening.